COVID vaccines, they offer a level of protection against the virus, but there is a common misconception that if you've been sick with COVID before, you have natural immunity, meaning your body has produced antibodies that help you fight off a future infection.
But does that truly protect you? And does it apply to the new Delta variant? Joining us now to help sort things out is Dr. John Whyte, who is Chief Medical Officer from WebMD. Dr. Whyte, good to talk to you. Thanks very much for joining us. And a lot of people have questions about this, and there's so much misinformation that's available at the click of a mouse. And so we really want to try to get the facts out. How likely are you to get COVID from the Delta variant, even if you're fully vaccinated?
So if you're fully vaccinated, the chances of you getting COVID that are going to put you in the hospital is very, very low. We do know that the vaccines do protect against severe cases of COVID. We're hearing about these breakthrough cases, people that are fully vaccinated that get COVID. But remember, most of those times, those are very mild cases. So you don't want to get the vaccine because you want protection and you're going to get it from the Delta variant.
There are, though, doctor, there are individuals for various reasons who cannot get the COVID vaccine, and as well as children under the age of 12. They have not been approved for vaccines. So what does the Delta variant mean for them?
The Delta variant, for those people that can't be vaccinated because of health reasons or because of age, says they need to be more cautious. So what does that mean? It means you need to wear masks when you're indoors, particularly if you're around people that you don't know their vaccination status. You're going to have to practice some physical distancing at times. Remember, the Delta variant is like COVID on steroids. It's much more transmissible, much more infectious. And it's a myth that people are thinking kids don't get infected, because we're seeing record number of kids infected and hospitalized. And as parents, we want to do everything we can to protect our kids. And that means getting vaccinated ourselves and then having our kids wear masks until they can be vaccinated or we get Delta under control.
We're hearing about businesses now that are telling employees, either new hires or just employees in general, that they must get the vaccine. There are some businesses who are saying, we don't want your business unless you have been vaccinated and you can show us your vaccine card. If there are folks out there that are still hesitant to get the vaccine and they have friends or loved ones who have been vaccinated and really want to try to encourage them to rethink this decision, what's the best way to convince someone who is still a skeptic?
Absolutely. And what I've been doing is kind of a soft approach. No one wants to be lectured at, and no one wants to be told what to do, but really to try to lay out the facts and show them how the cases are going up, and 99% plus of those are in those that are unvaccinated. We talked about people that have gotten COVID and think that's enough protection. Well, we now know that's not enough protection. You still need to get the vaccine because that's going to give you a stronger response, a longer response. And I always ask people, what's holding you back? What's your concern? And then you're able to address those misconceptions and that misinformation. And you're not going to convince them the first time, let's be honest. But maybe over time, you can get them to understand that this is the best option to protect themselves and protect their family and their community.
Dr. John Whyte, Chief Medical Officer from WebMD, we appreciate your time. We're all in this together, and we appreciate your insight.
Absolutely. Thanks.